Assalamu alaikum. I hope all of you are doing well. Today we are going to start the skeletal system. अच्छा जो at first मैंने सोचा था कि nervous tissue भी हम साथ में कर लें, but nervous tissue के लिए हमें too much detail में जाना पड़ेगा. It would take 3 to 4 lectures, so it's better if we do that with the nervous system or we do that in histology. So आज हम बाकायदा start करते हैं musculoskeletal system. स्केलेटल सिस्टम रिवाइज करेंगे. कुछ चीज़ें वो है जो कि अगेन जो हम बोन और कार्टिलेज पढ़ चुके हैं कनेक्टिव टिश्यू में, वही दोबारा रिवाइज होंगी. कुछ चीज़ें इसमें नहीं होंगी और कुछ ज़्यादा डिटेल में हम थोड़ा सा पढ़ेंगे इसे. तो आज थोड़ा ओवरव्यू लेंगे मस्कुलोस्केलेटल का. नेक्स्ट टाइम इंशाल्लाह अपर लिम्स वो स्टार्ट करेंगे. तो लेट्स सी व्हाट इज स्केलेटल सिस्टम. So skeletal system is composed of bones and associated ligaments, tendons and cartilages. So basically our skeleton and anything that helps in maintaining our posture, anything that helps in keeping the skeleton intact is known as skeletal system. उसमें जो चीज़ें होती हैं उसकी डिटेल पढ़ते हैं. Bone is a type of connective tissue. It is highly specialized hard form of connective tissue that makes up most of the skeleton. ठीक है. There are 206 bones in the body. अभी हम आगे इसकी डिटेल भी पढ़ेंगे. Then there is cartilage. Cartilage is a resilient semi-rigid kind of form of connective tissue. It is not that much hard as the bone, and it forms part of the skeleton where more flexibility is required, such as at joints. Tendons are the fibrous non-contractile and cord-like parts of a muscle, and ligaments are fibrous bands which connect the adjacent bones. So basically ligaments वो structures हैं जिन्होंने दो different bones के दरमियान में connection बनाना होता है. Tendons जो है वो muscle की origin और insertion पे muscle जो है वो fibrous non-contractile tissue में convert हो जाता है. That is known as a tendon. Now let's see the functions of the skeletal system. Skeletal system basically has the following functions. First, support. So skeletal system provides the support via the bones of leg, pelvic girdle, vertebral column. It helps in supporting the weight of the body and keeping an erect posture. So अगर थ्योरी ऑफ एवोल्यूशन को हम देखें तो उसके मुताबिक इंसान जो है वो मंकी से आगे इवॉल्व किया. ठीक है. हम नहीं मानते बीइंग अ मुस्लिम वी से दैट इंसान जो है वो वैसे का वैसे पैदा किया गया. बट थ्योरी ऑफ एवोल्यूशन कहती है कि पहले इंसान मंकीज़ की शेप में होता था, चारों इसे लिम्स को यूज़ करता था चलने के लिए. जैसे कि आज भी कुछ चिंपैंजीज गोरिल्लाज दे कैन यूज़ 2 limbs और 4 limbs to walk. So एवोल्यूशन के दरमियान में ये एक बहुत बड़ा पॉइंट था जब इंसान बाइपेडल हो गया, मतलब 2 limbs पे आ गया चलने के लिए, और इस तरह से उसकी 2 limbs कम्प्लीटली फ्री हो गई टू डू डिफरेंट टास्क्स. और उसी की वजह से फिर हंटिंग स्टार्ट हुई, फिर फार्मिंग स्टार्ट हुई, और आज हम इस सोसाइटी में खड़े हैं. So the erect posture is a very important point in evolution according to theory of evolution. Then another example of support is the mandible that supports teeth, makes up our jaw, that is mandible or jawbone. Other bones support various organs and tissues of the body, such as in thorax, ribs support in you can say protecting the lungs, as well as they have a role in expanding and contracting during the respiration. Bones also provide protection to the internal organs, such as the bones of skull. They have a very vital role in protecting the brain. If we get blows, we fall down, or during any kind of trauma to the head cavity, the cranial bones protect our brain against damage, because brain is basically in a closed space, so it is very prone to damage, and its damage can be lethal. And the cranial bones play a very, very vital role in protecting our brain. Similarly, ribs ribs and sternum protect the lungs and the heart. Ribs को आपको पता है, ribs पसलियाँ भी इन्हें कहते हैं. 12 pair of ribs are there, which is tall hanging. They protect the lungs and heart. What is sternum? Sternum is the breastbone. Here we can see this bone in the middle of the ribs, from where the ribs are attached, is known as sternum or the breastbone. This is manubrium, the upper process, and this is the body of sternum. Okay, then another example is the vertebra, which protect the spinal cord, which is located within them. They are located at the back of the body. Other functions of the bone is movement. So the bones along with muscles help in moving the different limbs, different parts of the body, and they act as levers while moving the body, such as the muscles and bones of limbs at knee joint, at hip joint, at wrist joint, at the elbow joint. Bones are a reservoir for minerals and adipose tissue in the body. It is basically a very important function of the bones. Most of the calcium of our body, up to 99% of calcium in our body, is stored in bones. The bones are made up of a molecule of calcium that is known as calcium hydroxyapatite, and it deposits the calcium in the bone. Calcium has many other functions in the body, such as in sodium, potassium, calcium channels. Calcium is present in the heart, which helps in maintaining the contraction of heart, maintaining the plateau phase, that helps in isometric contraction of all muscles of the heart. So if there is lesser calcium in the bone, it makes the bones brittle. Bones may break easily, and moreover calcium content of the body may also be decreased. That leads to arrhythmias. हार्ट की जो है हार्ट बीट वो बेतरतीब हो सकती है, पेशेंट में डाई ड्यू टू हाइपोकैल्सीमिया और हाइपरकैल्सीमिया. सो बोन्स आर reservoirs of calcium. Moreover, phosphorus, 85% of body's phosphorus is stored in bones. Adipose tissue, fat tissue, is also located in bones. It is found in the bone marrow of certain long bones. Bones have a very large, huge role in hematopoiesis. Hematopoiesis is the process through which blood cells are formed, especially the red blood cells, which help in respiration and transport of oxygen, are primarily produced within the bone marrow, because the bone marrow contains hematopoietic stem cells. Hematopoietic stem cells are those cells through which all the blood lines originate. It may be red blood cells, white blood cells, platelets. All the cells, they originate from hematopoietic stem cells, which are located in bone marrow. Now let's discuss the classification of bones. In total, in an adult human being, there are 206 bones, named bones, in a human body. In children, the bones are more in number, but as we grow, as a person becomes adult, many of the bones fuse together to form single bones. So all of these bones, they belong to basically two large groups of skeleton. One is axial skeleton and the other is appendicular skeleton. Axial skeleton is located along the long axis of the body. It includes the bones of skull, the bones of face, the bones of thoracic cavity, and the vertebra. So skull, vertebral column bones, rib cage, they make up axial skeleton. These are essential for maintaining the posture of the body. These are essential for protection of many important essential organs, such as the brain, such as the heart, such as the lungs. They are essential for that purpose. So they protect, support and carry other body parts such as intestines, stomach, all the things. They are located within the abdominal cavity. Okay, the other one is appendicular skeleton. Appendicular skeleton is basically composed of 4 appendages, that is 2 arms and 2 legs, and their joints with the axial skeleton. So the bones of upper and lower limbs and the girdles such as pectoral girdle and pelvic girdle, shoulder joint or shoulder, all of the bones involved in shoulder joint, they make up pectoral girdle, whereas the hip bones, they make up the other girdle. So let's see. They are basically involved in locomotion and manipulation of the environment. The appendages are basically there for locomotion. Locomotion is movement from one point to another point, and they are also important in manipulation of the environment. We can use our hands to manipulate the environment that is around us. Now let's look at the classification of different bones. So we'll start with skull. Basically, the skull is composed of 2 parts. One is cranium and one is face. Cranium or cranial cavity is composed of 8 bones in total, and face is composed of 14 bones in total. There are some bones which are located on both sides, right and left. Some bones there which are single in number. When we study the structure of head and neck, we'll go through the details. Then there is one bone that is located near the throat, that is known as hyoid. There are 3 bones on each sides which make up our ear cavity. Those are known as auditory ossicles. They are the smallest bones in the body which are located in the ear. Then there are bones of the vertebral column, 26 in number. You may have studied somewhere that there are 31, but the bones of sacrum and coccyx, they fuse together to this arrangement. In thorax there is 1 sternum and there are 12 ribs on each side of the body. So let's see now. This is the cranial cavity composed of 8 cranial bones. The facial cavity composed of 14 bones. Here there is hyoid bone. Then there are vertebras which are located over the back from the neck at the atlantoaxial joint up until the sacrum and coccyx. Then in the front, in axial skeleton, there is the sternum, and then there are ribs. Okay, so here we can see the upper part of sternum where the clavicle comes to attach with the sternum, that is known as manubrium or manubriosterni. Then there is the main sternal bone, and this part of the sternum where the sternum ends is known as xiphoid process of the sternum. So this is sternum. The vertebrae are divided into cervical vertebrae, then thoracic vertebrae, then lumbar vertebrae, and then sacral vertebrae, and in the end there is coccyx. Okay, now let's move on towards the appendicular skeleton. In appendicular skeleton there is a shoulder joint, then there is the upper limb. Okay, so shoulder joint is also known as pectoral girdle. In pectoral girdle there are 2 main bones on each side. One is the this one is clavicle, this one is scapula. So these 2 bones make up shoulder joint along with the bones of upper limb. The main bone of upper limb that constitutes the shoulder joint is known as humerus. One is located on each side. Then there are two bones of forearm that make a joint with the humerus, the elbow joint. Those are known as radius and ulna. Then there are 8 carpal bones, 5 metacarpal bones, and 14 phalanges. So remember this arrangement: 1 clavicle, 1 scapula, 1 humerus, 1 radius, 1 ulna, 8 carpals, 5 metacarpals, and 14 phalanges. This is the complete arrangement of the upper limb. Now let's get to the pelvic girdle. In pelvic girdle, there are 2 hip bones located on each side. They are connected with the sacrum as well as with the longest bone in the body, that is known as femur. So femur is the longest bone in the body. This one present in lower limb. The upper part of lower limb is made up of femur. Then there are 2 bones known as tibia and fibula. 2 are located on each side. Then tarsals, metatarsals, and phalanges. They are present in the same arrangement as the hand. There are 8 tarsal bones. There are 5 metatarsals. There are 14 phalanges. Okay, there's one more thing. There is a single patella that is located on each side. Patella is a small circular kind of bone that is located in front of the knee joint, also known as the kneecap. So here it is. This is patella. Let's see now. This is the hip bone. Then there is this bone known as femur, tibia, fibula. Larger one is tibia, smaller one is fibula. Then there are tarsals, then there are metatarsals, then there are phalanges. Here one bone is mentioned. This bone is known as calcaneal bone. Calcaneus. It is the bone which bears the weight of the whole body, and it is easily fractured if we fall from heights. Okay, one MCQ that comes again and again is which bone of the body is most commonly fractured bone in the body, or most easily fractured bone in the body. So that bone is the clavicular bone. Clavicle is the most common injured bone, fractured bone in the body. That makes a shoulder joint of the body. And so keep this in your mind. Femur is the longest bone in the body, and the smallest bones are found in here. Okay, now let's see. Let's talk about the bone classification. In total there are 4 types of bones in human body. There are long bones, there are short bones, flat bones, and irregular bones. Long bones are the main weight-bearing bones. They are the bones in which the length is more than the width of the bone. All the bones of the limbs except the patella are long bones. Moreover, the bones of the wrist and the ankle are also not considered as long bones, because they are shorter in length and they have the same kind of width and length. That's why they are also known as short bones. Short bones are basically cubical in shape. The bones of wrist as well as of ankle, these bones are known as short bones. So the tarsals as well as carpals are the short bones. These 8 are bones of wrist. Long bones are those bones which consist of a single shaft that is located in the middle then two broader ends on both sides. Now let's talk about flat bones. Flat bones are those bones which are thin, not very broad, are flattened and a bit curved. The scapula, which is located posteriorly in the shoulder joint, is a good example. Sternum is an example of flat bone. Ribs and most bone of the skulls are examples of flat bones. This is a sternum. Again, I'll repeat. The upper part of the sternum where the clavicle attaches is known as manubrium sterni or manubrium. The lower part of the sternum is known as xiphoid process. This is the body of sternum. Here the ribs are attached. So sternum is an example of flat bone. Now the MCQs may come from here. If it's a very high yield topic, MCQ would come like this. The clavicle is considered as a dash, and there would be 4 or 5 options, and you have to choose the correct one. Okay, now let's see the irregular bones. Irregular bones are weird in shape. As they do not fit the criteria of the above 3 types. The vertebra, the hip bones, 2 skull bones in particular, sphenoid and ethmoid, are irregular bones. Sphenoid and ethmoid are located behind the nasal cavity. They have large spaces within them, which are known as sinuses. They are for moistening the air which we breathe through the nose. They are for warming up the air that we inhale. So sphenoid and ethmoid bone, they basically make the base of the skull, and they are irregular bones. Okay, now let's talk about the bone structure. This one we have studied early on, so I'll just go through these. So we're revising these topics. The bone structure is as under. All the bones consist of a dense outer layer that is known as compact bone. So compact bone is the main part that provides the strength to the bone. The inner layer of the bone is known as spongy bone. That is a honeycomb of flat needle-like projections which are known as trabeculae. Trabeculae are basically needle-like projections with open spaces in between. So here you can see the outer structure, compact bone, and the inner structure, spongy bone, and as a whole it is covered by a layer which is composed of 2 layers, that is known as periosteum. We've studied the periosteum and its 2 layers in detail early on in the I think last slide. These are trabeculae in spongy bone, magnified. So these are trabeculae which contain the spaces for the bone marrow. Okay, here you can also see the marrow is located in the center of the bone. Around it is a spongy bone and then compact bone. Now let's discuss the structure of bones by each type. Let's talk about the long bone. Long bone is basically consisted of a long shaft. This one is a shaft in the middle and 2 expanded structures on both sides which are known as epiphyses. Okay, the shaft is known as diaphysis, and where the epiphysis meets the diaphysis, that part is known as metaphysis. Metaphysis is mostly clear in children and growing adults. So they consist of a thick collar. The shafts of the long bones consist of a thick collar of compact bone which surround a central bone marrow. Spongy bone is in a very thin layer, or it is not seen in long bones in mature individuals. In adults, this narrow cavity of bone marrow contains fat, so it is known as yellow bone marrow. Red bone marrow is that bone marrow which produces blood cells. And now let's talk about the expanded ends or epiphyses. Epiphyses consist of a very thin layer of compact bone, and the most part of epiphyses is composed of spongy bone. The surfaces of the epiphyses are covered by cartilage, that is hyaline cartilage, and on these surfaces, these epiphyses, this hyaline cartilage is known as articular cartilage. Articular is anything that is related to a joint, because bones are articulating on joints. So articular cartilage is that cartilage that is present in joints. Articular cartilage basically has the function of cushioning the bones on joints, and it reduces the friction between two bones at joints. Here we can see articular cartilage on femur. Here the tibia and fibula would attach with the femur. Okay. So the external surfaces of the entire long bone, except for the joint, is covered by a double layered membrane that is known as periosteum. We've already studied that. Periosteum contains an outer fibrous layer that is dense, irregular connective tissue, and an inner layer that contains osteoprogenitor cells and osteoblasts. What are osteoprogenitor cells? Osteoprogenitor cells are those cells which make up the bone, or osteoblasts are those cells which then mature into osteocytes, which form the bone. Periosteum is very richly supplied with nerve fibers, lymphatic vessels, and blood vessels. Here we can see the structure of periosteum, the inner lining and the outer lining. The blood vessels, nerve vessels, and the lymphatic vessels enter the bone of the shaft via nutrient foramen that is located at the epiphyses of the bone. Okay, in long bone, the internal bone surfaces inside the periosteum are covered with a delicate connective tissue membrane layer which is known as endosteum. Endosteum basically covers the trabeculae of the spongy bone in the bone marrow cavities, and it also lines the canals that pass through compact bones. That canal contains bone marrow and blood vessels to supply, etc. This endosteum contains osteoblasts as well as osteoclasts. Osteoblasts are bone forming cells, osteoclasts are bone absorbing cells. The structure of short, irregular, and flat bones is similar. They contain thin plates of periosteum which cover the compact bone on the outside, and endosteum is present inside that covers the spongy bone within. And these flat bones, short or irregular bones, do not have a epiphysis, diaphysis, because they are not cylindrical in shape. They contain bone marrow between the trabeculae of the spongy bone, and in flat bones, this internal spongy bone is also known as the diplo, and the whole arrangement of the flat bones resembles a sandwich. Here we can see it clearly. Suture is a arrangement where two bones meet, that is known as a suture. There is outer periosteum, then there is compact bone, then there is spongy bone covered with endosteum. Within the spongy bone there are trabeculae where the bone marrow is located. Okay, now let's discuss some embryology of the skeleton. How does the skeleton come in its place? So the skeleton is formed before 8th week of gestation in the uterus. The human embryonic skeleton is made up of fibrous membranes and hyaline cartilage. Hyaline cartilage then goes on to form the long bones, and fibrous membranes then form the flat bones and irregular and short bones. So here we can see a fetus. We can see the dark red structures which are hyaline cartilage structures. These are basically the blueprints where the bones would form. Here the hyaline cartilage blueprints, they form bones via endochondral ossification, whereas the mesenchyme forms the flat bones via intramembranous ossification. So there are two different methods through which a bone is formed. After 8th week, bone tissues begin to replace the fibrous membranes and hyaline cartilage, and the development from the fibrous membrane is known as intramembranous ossification, helps in forming flat bones, irregular bones, and the replacement of hyaline cartilage with bone is known as endochondral ossification. That forms the long bones. Intramembranous ossification occurs in some bones of the skull, such as frontal bone, parietal, temporal, and occipital bones. The facial bones, clavicles, pelvis, the scapula are part of mandible. These are all irregular, flat or small bones, and they form by intramembranous ossification. Prior to ossification, there is a fibrous layer that is known as mesenchyme, found in embryos. Here the ossification centers appear and start transforming that mesenchyme into ossified layer or into bone. In endochondral ossification, there is a model of hyaline cartilage that is replaced by bone. Most bones of the body, long bones, especially developed via this model, and the bones of the limb is a good example of endochondral ossification. Ossification basically takes place via different centers of ossification. There is a primary center, and then there are secondary centers of ossification. Primary centers appear before birth, during the 8th week of gestation, and they basically are responsible for the ossification of or the formation of diaphysis or the shafts of the bones. Whereas secondary centers of ossification appear after birth. They form the epiphyses, and they appear in the baby, and they are present up until a baby grows into an adult. Fusion of epiphyses with diaphysis starts at puberty and is completed by 25 years of age, after which there is no more bone growth. So a growth plate is present up until 25 years of age. If we see a young bone, a typical young bone ossifies in 3 parts in total. The 2 ends, that is epiphyses, where the secondary ossification centers are present and secondary ossification takes place, and the intervening shaft that forms a primary ossification center. Before ossification, the following parts are present: epiphysis, diaphysis, metaphysis. As you can see, metaphysis is not present in adult bones because the ossification centers are already closed. So metaphysis occur in young people, young patients. So these parts can be distinguished in a growing bone, in a young bone: epiphysis, diaphysis, metaphysis, and epiphyseal plate of cartilage. Here we can see this is the diaphysis. The part where diaphysis meets the epiphysis is known as metaphysis. Here the growth plate is present, and then there is proximal epiphysis, Here is the distal epiphysis. Articular cartilage is also present. Okay, epiphyses are present at the ends and the tip of the bone, and they ossify from secondary centers. These are the following types. There are two types of centers, two types of epiphyses basically. There are pressure epiphyses and traction epiphyses. They differ in their function. Pressure epiphyses are articular epiphyses which help in transmission of the weight of the body. For example, the head of femur, lower end of radius, they are weight bearing joints. So there the pressure epiphyses are present, whereas traction epiphyses are non-articular. They do not take part in transmission of the weight. They just serve as attachment to tendons of the body that exert a traction on the epiphysis. Traction epiphyses ossify later than the pressure epiphyses, such as trochanters of femur and tubercles of the humerus are examples of traction epiphyses. Now let's take a look at traction epiphyses, and let me see pressure epiphyses. Just a second. Okay, so here we can see this is the head of femur. This is pressure epiphysis that would ossify first, and they are the main weight bearing joints of the parts of the bone. These are trochanters. Trochanters are traction epiphyses. Here the tendons are dashed. Same here, these are traction epiphyses, pressure epiphyses, and these ones are traction epiphyses, these corners. Okay, here more types of epiphyses are discussed. Atavistic epiphyses are not phylogenetically independent bone which becomes fused to form another bone, such as coracoid process of the scapula. Coracoid process grows independently scapula, then near the scapula, then it fuses with the scapula. Coracoid process is basically the part where the clavicle comes to attach with the scapula. That is an example of atavistic epiphysis. Aberrant epiphyses are not always present. They are present at the head of first metacarpal and base of the other metacarpal bones for the attachment of metacarpals together. Now let's talk about the other parts of the young bone. There are diaphyses and metaphyses. Diaphyses are the elongated shafts of the bone which ossify first, and they form the primary centers. Metaphyses are epiphyseal ends of the diaphyses. Metaphysis is the zone of active growth in the bone. Here the lengthwise growth takes place. Before epiphyseal fusion, metaphysis is richly supplied with blood through end arteries that form hairpin bends, and it is a common site of osteomyelitis. Osteomyelitis is the infection of bones, mostly occur in children because of bacteria or emboli that are easily trapped in that hairpin bends of the arteries, and that cause infarction of the arteries and veins there, and hence the infection. Now let's talk about the epiphyseal plate of the cartilage. Epiphyseal plate is also known as the growth plate. It separates the epiphysis from the metaphysis. Proliferation of cells is taking place here, and these are mainly responsible for the lengthwise growth of long bones. After the epiphyseal fusion, these parts are not visible any longer, and there is no growth in length after that. The growth cartilage is nourished by both epiphyseal as well as metaphyseal arteries. Because the bones are growing, they require a huge amount of nutrition. There are 4 types of bone cells. Bone cells are divided into osteoprogenitor cells, which are the stem cells that are derived from mesenchyme, which produce other stem cells, and osteoblasts. Osteoprogenitor cells are present in endosteum, and in children they are present abundantly in the mesenchymal layer. Osteoblasts are those cells which produce new bone, and once osteoblasts become entrapped in the matrix, they mature, they produce and secrete, they are known as osteocytes. Osteocytes are mature bone cells. Osteoclasts are not derived from osteoprogenitors, they are related to macrophages basically. Macrophages which are present in bone are known as osteoclasts. They are formed from multiple cells, are multinucleated, they are basically responsible for the resorption of the bone. So osteoprogenitor cells develop into osteoblasts. Osteoblasts then mature and form osteocytes. Composition of bone matrix, we've done it earlier. Organic components are cells, collagen fibers, and ground substance. Inorganic components are calcium phosphate and hydroxyapatite. As I told you earlier, calcium hydroxyapatite crystals are present, which are composed of calcium phosphate and calcium hydroxide. These ones we've studied earlier. The microscopic structure of compact bone, if we see, it consists of multiple cylindrical structures which are known as osteons. Osteons are Haversian systems through which the Haversian canals run. These osteons are weight-bearing pillars of the bone, are arranged parallel to one another and along the long axis of the bone. Each osteon consists of a singular central canal that is known as Haversian canal, that is surrounded by concentric layers of calcified bony matrix. Here you can see the Haversian canal in the middle and then the calcified part of the bone. Haversian canals allow the passage of blood vessels through the bone, lymphatic vessels and nerve fibers through the bone. Each of the concentric matrix tubes that surround the Haversian canal is known as a lamella. We've discussed it in the earlier slide, what is lamella, what is Haversian system. So all the collagen fibers in a particular lamella run in a single direction, upside to downwards, and while the collagen fibers in adjacent lamella will run in opposite directions to each other. This allows the bone to better withstand twisting forces, better withstand the weight that is put on the bone. Here we can see the Haversian canals that are running from upside down to downwards, and Walkman canals which are present in between that run horizontally. So Walkman canals connect the blood vessels, nerve supplies in the periosteum to Haversian canals and medullary cavity. If we look at the microscopic structure of spongy bone, we've looked at it earlier. They appear poorly organized as compared to compact bone. They lack the osteons, they lack the lamella. Trabeculae are few, trabeculae are open spaces, and they are few cell layers thick. They contain irregularly arranged lamella and osteocytes interconnected by canaliculi. Canaliculi are small channels through which the blood vessels, etc. Are present. Blood supply of the long bones is derived from the nutrient artery, periosteal artery, epiphyseal artery, and metaphyseal artery. The other bones contain different blood vessels which are present adjacent to the bone. Here you can see the metaphyseal artery invaginating the bone, going into the bone, and it goes in from the periosteum. Then it is divided into the smaller canal system. Periosteal arteries supply the periosteum of the bone. Nutrient artery is the main artery that is that invaginates from the diaphysis, supplies the bone, mainly the medullary cavity. Here we can again see the metaphyseal and epiphyseal arteries and articular cartilage. Cartilage we've studied earlier, form of a connective tissue. It is weaker than bone, flexible than bone, and consists of chondrocytes and matrix. General features: it has no blood supply or lymphatics, has no nerves, it is insensitive. Cartilage is surrounded by a fibrous membrane that is known as perichondrium, and articular cartilage does not have any perichondrium, and that's why regeneration is not adequate in the articular cartilage. The cartilage receives nutrition by diffusion from the capillaries in perichondrium. Because the arteries do not invaginate, do not penetrate the cartilage, and it also receives from synovial fluid. In case of articular disc, in synovial joints, the articular cartilage derives its nutrition from the articular disc, and it also receives its blood supply from the surrounding capillaries. If deprived of nutrition, chondrocytes die, matrix is calcified, and bones and this cartilage turns into calcified bones. This is known as osteoarthritis, mostly seen in old age patients. Their joints are not so easily movable. They have pain in joints, friction in joints. That is due to loss of nutrition of cartilage. There are three types of cartilage: hyaline cartilage, fibrocartilage, and elastic cartilage. I've explained it in detail, I think, in the previous lecture. Here there is a comparison of hyaline, fibro, and elastic cartilage. You have to know it by heart, so go through it and cram it if you can, because it would come in exams, it would come in MCQs in exams, and there is no other method than to cram it. So रट्टा लगाना पड़ेगा इसको. Here you can see hyaline cartilage, fibrous cartilage. Fibrous cartilage is tougher as compared to the hyaline cartilage. Okay, now some applied anatomy points. Periosteum is very sensitive to tears or tension. So fractures, tumors, and infections of the bones are very painful. Cartilage does not have any innervation, so it is not sensitive, it does not cause pain, whereas the periosteum of the bone is very rich in nociceptors, pain receptors. So fractures or tumors of bones or infections of bone are highly painful. Fracture is known as a break in the continuity of a bone. It may be smaller, that is known as hairline fracture, or it may be larger, such as a comminuted fracture. Rickets is a condition in which there is deficiency of vitamin D, hence the deposition of calcium into the bones is faulty, and calcification of the cartilage fails, ossification of growth zone is disturbed, bowing of bones takes place, growing bones are effective, mineralization, calcification does not take place. Multiple bony deformities can occur, such as bowing of bones. जो long bones होती हैं, such as the bones of legs, they bow out. जैसे टेढ़ी हो जाती हैं, जैसे चांद होता है टेढ़ा, वैसे टेढ़ी हो जाती है. ठीक है. सो रिकेट्स में ये होता है, बच्चों में होती है ये कंडीशन जिनकी न्यूट्रिशन एडिक्वेट नहीं होती, जिन्हें विटामिन डी और कैल्शियम सही से नहीं मिल रहा होता. अच्छा, आज की स्लाइड मैंने इसलिए रश की है क्योंकि बेसिकली काफ़ी सी चीज़ें हम पहले पढ़ चुके हैं. जो चीज़ें नई थी वो एक दफ़ा देख ली हमने, कुछ चीज़ें दोबारा रिवाइज कर ली. ये स्लाइड मैं पोस्ट कर देता हूँ, डिस्कस इट अमॉन्ग योरसेल्व्स, और अगर कोई क्वेश्चंस हैं तो मेरे से पूछें. अच्छा बच्चे, जहाँ तक टेस्ट का सवाल है, टेस्ट वुड बी कंडक्टेड ऑन नेक्स्ट मंडे इंशाल्लाह. इट वुड कंप्राइज फ्रॉम द टॉपिक्स विच वी स्टडीड टिल नाउ. आज का जो टॉपिक है ये उसमें इंक्लूडेड होगा. अप टू 30 MCQs होंगे. ठीक है, बार बार बच्चे पूछ रहे हैं क्या सिलेबस है, क्या कुछ है. तो बच्चे जितना आपको स्लाइड में पढ़ाया है उसी मटेरियल में से टेस्ट आएगा. एटलीस्ट 60 to 70% क्वेश्चंस वुड बी फ्रॉम दिस मटेरियल. 30% क्वेश्चंस इसी से रिलेटेड होंगे. स्टडी दिस टॉपिक्स फ्रॉम डिफरेंट बुक्स. यू कैन स्टडी हिस्टोलॉजी टॉपिक्स फ्रॉम इंद्रबीर सिंह और मोहम्मद आमिर's book. you can study the anatomy topics from the BD Chaurasia book or the Snell's anatomy. तो तैयारी करें, आसान क्वेश्चंस होंगे और इस टेस्ट का ऑब्वियसली तैयारी करके दें, बट यू शुडंट बी वेरी मच वरीड. सो इतनी ज़्यादा टेंशन लेने की ज़रूरत नहीं है, डू और डाई सिचुएशन नहीं है. सो ट्राई टू पास इट. इफ़ यू कैन नॉट पास इट देन यूल नो कि आपकी शॉर्ट कमीज क्या है, कहाँ पे तैयारी में कमी रह रही है. सो तैयारी करें, ठीक है. और कोई भी क्वेश्चन हो वो पोस्ट करें ग्रुप में. और बच्चे कोशिश करें कि जब भी आप क्वेश्चंस पोस्ट करते हैं तो पोस्ट इन द मॉर्निंग, ठीक है. और टाइम्स पे पोस्ट ना करें, क्योंकि बच्चे बाज़ औक़ात और टाइम्स पे पढ़ रहे होते हैं, क्वेश्चन पोस्ट करते हैं, मैं नेक्स्ट डे तक उसका आंसर नहीं दे सकता, तो कंटिन्यूटी वो टूट जाती है, ठीक है. तो व्हेन यू आर स्टडिंग, राइट डाउन योर क्वेश्चंस ऑन अ पीस ऑफ पेपर और ऑन द बुक. You can post it in the morning and I can give you answers right away. So try that. और बाकी अपना ख्याल रखें, ठीक है. ओके, अल्लाह हाफ़िज़.